welcome to Beatrice Health Tips. Last week I started to talk to you about how to prevent Alzheimer and Parkinson, and I mentioned the cause as a naturopathic approach, what are causing these degenerative disease. And now I'm going to tell you what we can do about it. So the big question I asked last time in conclusion is, how fast is our brain aging? That's the question. We all age, but how fast? You can probably already see precursor signs of an aging brain, and it really doesn't matter how old you are for that. Earlier sign of aging brains are fatigue, promoted by brain activity. For example, driving. You used to have a resistance and be able to drive for 2 or 3 hours before feeling tired, mentally speaking, I'm talking about. And now you notice that instead of 2 or 3 hours, well, it's 30 minutes, 45 minutes, whatever. But that time of resistance has reduced. That's a sign, a precursor sign of an early brain activity that is reducing. Same thing for reading, concentration and brain task. If you see a difference and you're like 40 years old, that's not normal. If you're 95, that's okay. But at 30, 40, 50, 60, it's still too early to have a noticeable difference in the ability of your brain to concentrate and stay focused. So the typical symptoms are going to, well, I can't remember where I parked my car, where I put my keys, I can't remember phone numbers or names, people's faces. Now, one thing to know is that if you have always been a distracted person, you've never been someone that concentrates well, then that's not a sign of aging brain. What it is that you have always been like that. What I'm talking about is that when there is a difference, a noticeable difference between your ability to concentrate, to remember, or to drive, and now, that's what's important. In Parkinson, early signs are people that are walking and hunching, hunched over, and they walk hunched. And you can also see sometimes a difference in the tone of their face, like the left side has a difference between the left side and the right side. It could be depression for both disease, and could be poor digestion function, like chronic constipation, poor enzyme production, and chronic infection. Again, not to panic anybody here, but a lot of people have digestion issues. As you know, that's my specialty. However, if you notice that these digestion issues are not improving despite all of your efforts of good diet, of treating underlying causes, heavy metals, stress, pesticides, infections, etc., and you don't see any improvement, and you take tests that are showing that your digestive system is slowed down, then it could be from the top down, meaning from the brain. The brain affects certainly the entire digestive system. It could be also in that same realm of symptoms, a difficulty to swallow and a very dry mouth. Then it will evolve, to moderate signs of brain aging, and then more severe. And when we're at the more severe, then it's neurodegenerated, uncontrolled bladder tone, uncontrolled bowel or bowel obstruction, inability to taste, to smell, inability to enjoy life. There is neurotransmitter. Our neurotransmitters are very important for this brain function, of course, because they transmit information. There are 4 different major neurotransmitters, which I will go through very quickly here. First one is serotonin. As you may know, when you have enough serotonin, you feel happy. When you don't have enough serotonin production, you may feel guilty, depressed. You have an inability to enjoy life, to enjoy hobbies and friends. You are more depressed in overcast weather, and basically you lose interest in life. Then there's dopamine. A lack of dopamine will give symptoms such as hopelessness, worthlessness, inability to handle stress, lack of self-motivation to start and to finish tasks, and the need for caffeine to stay focused. As you know, the lack of dopamine is the reason why people develop Parkinson's symptoms. There is GABA. A lack of GABA will give anxiety or panic attack for no reasons, difficulty to shut off the mind, feeling overwhelmed for no reason, disorganized attention, restlessness, difficulties to let go, difficulties to fall asleep. And then acetylcholine. Lack of acetylcholine will give you a lack of photographic memory, a lack of sense of directions, poor memory, and slow mental speed. There are other neurotransmitters. I'm just giving you a little information, tidbit bit of information about the most important neurotransmitters. So what to do when you want to keep your brain healthy? Well, first of all, there is a questionnaire that I use to assess people's neurotransmitters that you can fill out, and that will give me a piece of information. After that, nutrition, nutrition, and nutrition. You need to eat food that is rich in nutrients, that is easy to digest, and it's poor in toxins. Example, broth, egg yolk, liver. Those are very rich food in nutrients and vitamins. They have very, very little waste material. They're easy to digest for most people. Then you need to seal the gut, heal the leaky gut with a protocol like GAPS. You need to maintain your blood sugar balance. Blood sugar is absolutely crucial to the brain, but you need to be sure that it's not high and it's not low. Hypoglycemia is as damaging to the brain as is diabetes. Please refer to my podcast on blood sugar. Keep a good quality sleep. For your brain to rejuvenate, you need to sleep. Good quality sleep. Quiet place. No iPhone. No Wi-Fi. In a dark room, etc. Get essential fatty acids, as in fish oil, cod liver oil, sesame oil, olive oil, and coconut oil. There is a lot of research done on coconut oil and Alzheimer. It really, really helps. Reduce inflammation by removing the cause, but you can also use curcuma or turmeric and resveratrol combined, which have powerful anti-inflammatory effect. You can slow down the oxidation. Oxidation means rusting, means aging. How do we reduce or slow down oxidation? Well, you can use glutathione product or glutathione precursor beside good food and sleep and all of the above. You need to increase blood flow to your brain, and you do that with exercise. You can also do that with a supplement called Nitric Balance from Apex Energetics and Neuro2 from Apex Energetics. Very powerful supplements. If you have a methylation problem, you need to correct it or compensate for it is a better word, with methyl-SP, folate, or 5-tetrahydrofolate, which is a form of folic acid that is already pre-digested, if you want, or pre-metabolized for you. We need to stop the autoimmune process with a GAPS diet, with repairing the gut and balancing the immune system. You can support the neurotransmitters. We have supplements that will help the production of dopamine, of serotonin, GABA, or acetylcholine. I personally take a supplement to raise my dopamine because of my family history with Parkinson. And more importantly, avoid taking statins. Avoid any medication that is not necessary because they all have a very strong effect to the brain. All right, this is my best recommendation. I hope you enjoyed this podcast. Please forgive if you hear a little noise around me. I have two adorable Labradors coughing and sneezing. I wish you happy holidays, happy end of the year, Christmas and Hanukkah, and certainly a wonderful 2018 year. I look forward to um, communicate with you. If you have any comments, please do so. Leave comments, email me, contact me. I'll be happy to answer more of your questions. Take care. Bye bye.